Assalamu alaikum. Dr. Hussain Bush Kolachi YouTube channel is with you, and today we will discuss health and high altitude, its impact, the role of Himalaya mountain in Pakistani population, environment, health, and climate change. So let us move to the second slide, and you can see this is the Everest, the highest peak of the Himalayan mountain, which has Greater Himalaya, Lesser Himalaya, as well as the Sub Himalaya. So it is almost uh, stretching in 2,400 kilometer, and it is 2 to 3 kilometer wide mountainous range, which is the highest range in the world, and it is also called the water tower of the world. It touches almost six countries, in which Pakistan, India, Nepal, Bangladesh, as well as uh, some other Asian countries like Sri Lanka, and these are the parts of India. Pakistan, it is almost 200 kilometer long range, and here we have the Naga Parbat and Hindu Kush as well as Karakram. So this is a very important geologic and geographical structure which has enormous impact on our health. Let us see high altitude in Pakistan, Himalaya region causes low oxygen level, and you can understand oxygen is the basis of life. And then it can lead to the acute mountain sickness or AMS, high altitude pulmonary edema, HAPE, and high altitude cerebral edema, HACE. Prevention and treatment requires gradual ascent, hydration, and immediate descent if severe symptoms are appearing. Then these are the very busy slides, but you can see that the pressure is the main, and the low oxygen are both important. So pressure as a function of height above the sea level, body can perform best at sea level. So as you move up, and at sea level it is almost 101325 uh, partial pressure, or 1013.25 millibars. This is the concentration of oxygen is 20, and so the partial pressure of oxygen O2 is 20.9. So the partial pressure of O2 is 21 kilopascal, or 1.58.33 millimeter of mercury. In a healthy individual, this saturates hemoglobin to oxygen binding, red pigments in red blood cell. So this is important. So we are basically a creature which are happy at the sea level, and our blood circulation is better. Atmospheric pressure decreases following the barometric formula with altitude, while the oxygen fraction remains constant to about 100 kilometer. So uh, oxygen pressure decreases with altitude, as well as it is about half of its sea level value at 5,000. Then the at 8,840, the summit of the mountain Everest. Uh, so high altitude level can be caused, or these are the liver uh, hormones or liver functions, enzymes, heart disease, or other condition, or corrective steps need treatment. The International Society of Mountain Medicine, it is a special branch you can see as the mountain medicine of the health. It says that high altitude means 3,000 meters from 1,500 and very high 500 and more than 550 is extremely high. Travel to each of these altitude regions can lead to the medical problem from the mild symptoms of acute mountain sickness to the potentially fatal high altitude pulmonary edema. High altitude cerebral means brain edema. The higher the altitude, the greater is the risk. Expedition doctors commonly stock a supply of dexamethasone to treat this condition on site. Research also indicates that elevated risk of permanent brain damage is also caused. So this is once again the beautiful picture of the mountain Mount Everest. And mitigation may be supplementary oxygen, environment protection, combination of both in all cases, raising oxygen partial pressure is important. Room air at altitude can be enriched with oxygen without introducing an unacceptable fire hazard because oxygen can catch fire at an altitude of 800 millimeters. The equivalent altitude in terms of oxygen partial pressure can be reduced to below 4,000 meter without increasing the fire hazard beyond that of normal sea level atmospheric pressure. In practice, this can be done using oxygen concentrators. This is also one of the busy and it touches the temperature as well as lapse rate means the difference between land temperature and the atmospheric temperature are between two temperatures. We call it lapse rate. And then we have air with decreasing pressure. Mount Everest, the average summer temperature is minus 19 or minus 2 Fahrenheit. So at that we can have frostbite, hypothermia, skin injuries, freezing of finger, toes, nose, ear, cheek, and chin. Body core temperature goes below 35, which is almost 2 degrees lesser than or 3 degrees lesser than the core temperature. Symptoms rate shivering, mental confusion, hallucination, and cardiac arrest. In addition to cold injuries, breathing cold air can cause dehydration, sunburn. This is also higher risk of sun due to the reduced blocking of ultraviolet by the thinner atmosphere. The amount of ultraviolet rays increases approximately 9% with every increase of altitude of 100 meters. Symptoms of sunburn include red or reddish skin, painful touch, fatigue, dizziness, and blistering feeling of skin, swelling, itching, and nausea. This was the deer. The proper name is Bear Grylls. Actually, this person was in the military forces of UK and from parachute it fell down from just like a spy and had 3, 4 injuries on the back and vertebral column, took to the hospital, and after 18 months he recovered and went up to the Mount Everest. So this is something which a human confidence and human body can give you the strength and confidence that even in the worst of the worst situation, you can have success, you can have fame, you can have health. He is a thinker person in the UK very famous person known as man, the chosen in the wild with Bear Grylls. So, new reality series. This is a prime time focus. So, with this, I think the Himalaya in subcontinent is not only a mountain, but it is a mountain of the health, fresh water, climate, monsoon, our economy, our GDP, and even our skin color and life is also attached to the subcontinent specific weather patterns, including the summer, winter, and our nutrition is also with the fruits and many other. We have masala jat, or we can have these kind of spices for which the Britishers came here. We have different trees, we have different plains, we have ocean waves as well as beautiful rivers like Indus. So in that part, I think is living just like in a kind of area which is, I think, restored by the sky, by the nature. From every angle, we have different seasons. We have summer, we have winter, we have sunlight, we have clouds, we have moonlit, so on and so forth. So, Dr. Hussain Kolachi YouTube channel today touched this important aspect, and I hope this will give you a new insight that high altitude, particularly polycythemia, is asked from the means the white cell and other cells they increase when you are about at the high altitude, and this can cause a blood kind of disturbance. So with this, I think Dr. Sanbush Kolachi YouTube channel is, and one of the questions which normally I ask from my rarefication of the air, rarefication means thinning of the air as you move to the higher altitude, and temperature also becomes low when you go up, but pressure becomes higher at that level. So these are inversely proportional. The low temperature, the higher pressure, the higher temperature, the low pressure. So this is a kind which actually gives the direction to the winds. We call it monsoon winds, which in summer go up to the Tibetan plain and up to the Himalaya, and then become saturated, and the showers are there. Ultimately, in winter, we have a stable and cool air. So this pattern is a very beautiful pattern in our subcontinent. We are lucky that we are making this video from Hyderabad, and today also this is August and monsoon rain clouds making Hyderabad and the sun as well as the subcontinent not only sky are blue, but we have clouds and patterns in beautiful air. Thank you very much. Please like it, share it, and if you have any comments, queries, or anything which is to be improved, please just drop in your comment box. Thank you very much, and please push the button so that we can you can receive such kind of a video.